Picture this. It's a Tuesday morning in January 2026. You're sitting at your kitchen table, sipping your coffee, and you open an envelope from your health insurance company. It's your renewal notice. Last year, you paid $420 a month for your family's health insurance. You're not poor. You're not rich. You're firmly in the American middle class. You're working full-time, you're playing by the rules, you're doing everything right. You unfold the letter. Your new monthly premium is $940. Not a typo. More than double what you paid last year. That's an extra $6,240 per year. Out of pocket. Before a single doctor's visit. Before a single prescription. Welcome to health insurance in 2026. And the most unsettling part, the math on this only gets worse from here. My name is Jenna, and I spend way too much time obsessing over the financial systems that regular people are actually trying to survive. Taxes, housing, debt, retirement, and right now at the top of that list, health insurance. Because something massive happened on January 1st of this year, and almost nobody is breaking down what it actually means for your wallet. Hit that subscribe button and give this video a thumbs up so the algorithm shows you the next one. If you have ever opened a medical bill and felt your stomach drop, this video is for you. Now, before we dive into who can actually afford health insurance in 2026, you need to understand the story of how we got here. Because once you understand the story, the math stops being mysterious and starts being absolutely predictable. Rewind to 2021. The world is deep in the COVID pandemic. Millions of Americans are losing their jobs. Tens of millions are losing employer-based health insurance overnight. And Congress passes the American Rescue Plan Act, which does something fairly dramatic. It temporarily expands the subsidies on the Affordable Care Act marketplace. Two big changes. First, it caps how much anybody pays for marketplace health insurance at 8.5% of their income, no matter how much they earn. Second, it removes the old 400% of federal poverty level cliff, which had previously cut subsidies off completely for anyone earning above that line. For the first time since the ACA passed in 2010, a family of four earning $140,000 a year could actually get help with health insurance. A self-employed couple in their 50s could afford a marketplace plan. A gig worker could finally get covered without bankrupting themselves. And enrollment exploded. By 2025, nearly 24 million Americans were enrolled in ACA marketplace plans, 90% of them benefiting from these enhanced subsidies. Then, in 2022, Congress extended the program for 3 more years through the Inflation Reduction Act, set to expire December 31st, 2025. Fast forward to the fall of 2025. Congress is debating whether to extend the subsidies again. There's a government shutdown. Both parties propose competing extensions. The House files a discharge petition. The Senate fails to reach an agreement. The clock runs out. And on January 1st, 2026, the enhanced subsidies simply expire. Now we're in 2026. And the people who counted on those subsidies are getting renewal letters that look like they've been pulled out of a financial horror movie. The Kaiser Family Foundation estimates the average premium payment is going up by 114%. That's an extra $1,016 per year per enrollee, on top of premiums that were already rising 26% on average across the marketplace. 22 million Americans are affected by this. That's the entire population of New York and Florida combined. This is the cliff. The cliff is real. And it just happened. So that's the setup. Now, let's get into who can actually afford to be insured in this new reality. Layer 1 of the new math. The ACA marketplace numbers, as they actually exist in 2026. If you buy insurance through Healthcare.gov, your monthly premium is now calculated under what's called the original ACA formula, pre-2021 rules. Under those rules, anyone earning above 400% of the federal poverty level, which in 2026 is $62,600 for a single person, $84,600 for a couple, or $128,600 for a family of 4, gets exactly 0 subsidy. Not a reduced subsidy. Not a partial subsidy. 0. The cliff is back. Earn $1 above the threshold, and you owe the full unsubsidized premium. $1. Here's what that means in real dollars. KFF just released data on a real couple outside Atlanta. $30,000 of annual income. Their premium tripled from $162 a month to $483 a month. That is an extra $3,852 per year on a $30,000 income. Nearly 13% of their entire household income, just to keep the same plan they had last year. A family of four earning $140,000, solid middle class, but a single dollar above the cliff, is looking at unsubsidized premiums of $1,800 to $2,500 a month for a benchmark silver plan. That's $21,600 to $30,000 per year. For premiums alone. Before deductibles. Before copays. Before the out-of-pocket maximum, which for 2026 is set at $9,200 per person and $18,400 per family. Add up the worst case. $30,000 in premiums plus $18,400 in out-of-pocket maximum. $48,400. That's your absolute exposure if you have any serious medical event. Almost $50,000 on a $140,000 income. 35% of your gross income. This is not insurance anymore. This is a coin flip on whether the year wipes out your savings.
All right.
So if marketplace insurance is brutal, the obvious move is to get employer-based coverage.
Right?
It's the gold standard. Big company. Subsidized by your employer. Has to be cheaper. Layer 2. Let's actually run that math. The Kaiser Family Foundation just released the 2025 Employer Health Benefits Survey. The average annual premium for family coverage through your employer is now $26,993. That's not a typo either. $27,000 a year. The average cost of a family health insurance plan in this country is now equal to the price of a brand new Toyota Corolla hybrid. Every year. Forever. Now, your employer covers most of that. The average worker contributes $6,850 per year toward their family premium. That's still significant. About $570 a month coming out of your paycheck just for the privilege of having insurance. But here's where it gets ugly. The average deductible for a single employer-based plan is $1,886. For family coverage, it's typically $3,000 to $5,000. That's the amount you have to pay out of pocket before insurance covers anything. Then there's copays. Then there's coinsurance. Then there's the out-of-pocket maximum, which for employer plans averages around $6,000 for individuals and $12,000 for families. Let me add it all up for a typical American family of four. Workers' premium share, $6,850. Family deductible, $4,000. Copays and coinsurance through the year, let's say a conservative $2,000. Out-of-pocket maximum, if you actually hit it, $12,000. Even if you do not hit your out-of-pocket maximum, you're looking at roughly $13,000 per year in real healthcare expenses through your great employer plan. That's 20% of the median household income in this country. 20% of everything a family earns goes to medical expenses. And that's the system that's supposedly working for them. For a single person, the math is slightly better but still brutal. $1,440 in premium contribution. $1,886 in deductible. Maybe $1,000 in copays. Even in the best case, you're paying over $4,000 a year for your employer-provided coverage. And that's if your employer offers it. Part-time workers? Only 27% of large firms even offer them coverage. Small business employees? Many small companies don't offer it at all. Gig workers? Self-employed? You're on the marketplace anyway. Layer 3. The math of going without insurance entirely. Because for millions of Americans right now, that's the calculation happening at kitchen tables across the country. In 2019, Congress eliminated the federal penalty for not having health insurance. The individual mandate fine? So technically, nationally, there's no financial penalty for going uninsured. 5 states, California, New Jersey, Rhode Island, Massachusetts, and Washington, D.C., still have their own state-level mandates. Everyone else? Free to go without. The Urban Institute estimates that 2.2 million to 7.3 million Americans will drop their insurance coverage in 2026. Not because they don't want it, because they cannot afford it. And the political reality is that this is largely permanent unless Congress acts. So let's run the math on going without. Sounds appealing. You save $27,000 a year. Until something goes wrong. The average emergency room visit in the United States costs around $2,200 without insurance. A broken leg can cost between $2,000 and $6,000. A 3-day hospital stay averages around $30,000. A heart attack treatment, fully uninsured, easily exceeds $100,000. And medical bills are still the #1 cause of personal bankruptcy in this country. So you're betting that nothing will go wrong. For a year. For multiple years. And here's the brutal honesty most YouTube finance videos won't tell you. If you're under 35, healthy, no chronic conditions, no family history of cancer or heart disease, and you have at least $20,000 in cash savings, you might be making a defensible bet by going uninsured short-term. But for everyone else, it's Russian roulette with your entire financial future. One bad day in an emergency room can erase a decade of careful saving. So what do you actually do? This is not a video where I diagnose the problem and leave you stuck. Layer 4. The actual moves you can make right now. Move number 1. Go to healthcare.gov anyway. Even if you've never qualified before. Even if you assume the subsidy cliff applies to you. Because some states are stepping in with their own subsidies. California allocated $190 million to replace the federal subsidies for its lowest income enrollees. Massachusetts put in $250 million. Maryland, Connecticut, and Washington all have state-level programs. Run your numbers. The state map is changing month by month. Move number 2. If your employer offers an HSA-eligible high-deductible plan, seriously consider it. The premium is lower than a traditional PPO. You can save up to $4,400 individual or $8,750 for family in 2026 in a health savings account, completely tax-free. The money grows tax-free. You can use it tax-free for medical expenses. And after you turn 65, you can pull it out for any purpose at all. It's the single best tax shelter in the entire United States tax code, and most people don't even know it exists. Move number 3. Ask your employer about ICHRA. That's an individual coverage health reimbursement arrangement. It's a newer model where your employer gives you a fixed dollar amount each month, say $600, that you use to buy your own marketplace plan. This lets you pick a plan that actually fits your situation instead of a one-size-fits-all corporate plan. About 9% of small businesses now offer it. If yours doesn't, ask about it. Move number 4. If you're between jobs, COBRA exists. Yes, it's expensive. You'll pay the full employer plus employee premium plus a 2% admin fee. But for short-term coverage gaps, it's often cheaper than buying marketplace insurance unsubsidized. Run the math. Move number 5. If you're under 26, you can stay on a parent's plan. If you're over 65, you have Medicare. If you make under 138% of FPL in a Medicaid expansion state, you qualify for Medicaid. Check all 3 before assuming marketplace is your only option. Let me zoom out for a second, because the deeper truth here isn't really about health insurance. It's a much bigger pattern. The American healthcare system, as it currently exists, is one of the largest invisible transfers of wealth from regular people to corporations in the history of money. Imagine being a middle-class family paying $27,000 a year for family health insurance, just to maintain coverage. Just to maintain a baseline. Forever. Inflation adjusted, that's roughly $2.7 million of inflation-protected payments over a 30-year working career. Now imagine if that same family could redirect just the worker's contribution, $6,850 a year, into a low-cost index fund instead. At an 8% average annual return, that becomes $775,000 over 30 years. $750,000. Just from redirecting one healthcare expense. This is the part nobody on YouTube talks about. The healthcare system is not just an inconvenience. It is the single biggest reason regular Americans cannot build wealth. Because the dollars you would compound into wealth go to insurance companies, hospital systems, pharmaceutical manufacturers, and PBMs instead. And here's the contrast. The wealthy don't pay these full costs. They self-insure for routine care through direct primary care arrangements. They maintain catastrophic-only plans. They have HSAs maxed out and invested. They negotiate prices in cash. They use medical tourism. They have the cash flow and the information advantages to opt out of the broken system entirely. Same care, sometimes better care, half the cost. The information gap is the wealth gap. And once you see this, you can't unsee it. Let me paint you a picture of what actually navigating this looks like. It feels like checking healthcare.gov on a Sunday afternoon with your spouse, running the numbers for your specific income and family size, and finding out you qualify for a state-level subsidy you didn't know existed. It feels like opening your HSA balance at the end of the year and seeing it grow by another $1,200 because you funded it pre-tax, you invested it in the market, and your healthy year didn't deplete it. It feels like switching from a traditional PPO to an HSA-eligible high-deductible plan and watching your monthly take-home pay actually go up, not down. It feels like sitting at a Thanksgiving dinner and listening to your in-laws stress about premium increases while you have the actual numbers and the actual playbook, calm and prepared. It feels like getting a hospital bill, calling the billing department, asking for the cash price, and watching it drop by 60% in a single phone call. It feels like becoming the person in your family who actually understands how this system works. Not because you got lucky, because you read the rules and made the math your friend. And honestly, that mindset shift by itself is worth more than any single insurance plan ever could be. So there you have it. Who can actually afford health insurance in 2026? If you have employer-sponsored coverage with significant employer contribution, you're paying roughly $13,000 a year all-in for family coverage. Painful, but workable on middle-class income. If you're on the marketplace with subsidies, meaning under 400% of FPL, your premiums went up, but you still get help. Run the numbers on healthcare.gov. If you're above the 400% FPL cliff, you're facing the full unsubsidized premium. Potentially $1,800 to $2,500 a month for a family. Find ways to reduce your modified adjusted gross income through HSA contributions, traditional retirement contributions, and other deductions. Even staying just under the cliff can save you tens of thousands. And if you're self-employed or gig, explore ICHRA arrangements, HSA-eligible plans, and direct primary care. The old model is breaking. The new model is being built in real time. The system is brutal. The math is unforgiving. But the framework is learnable. And once you have it, you stop being a victim of the system and start being a navigator of it. Hit subscribe so the algorithm shows you the next one. Because there's a whole world of these decisions out there. And we're going to find the actual answers together. Your future self is going to thank you for the decision you make today.